Connecticut Congressman John Larson chairs the House Democratic Caucus. There has been talk, and this gets into some of those arcane rules of the House, but there has been talk, Congressman, about bringing the bill straight in for a vote and bypassing that Energy and Commerce Committee. Is that a possibility?
Well, anything is possible in the United States Congress, but I'll tell you what's going to happen. We're going to make sure that we have a caucus starting Monday morning at 4 in the afternoon, making exceptions for those who have to travel from the West Coast to get here, where we're going to go through every section of the bill, page by page by page. Also, members have a lot of reading to do over the weekend, and also with a series of questions that they have, et cetera, to put the caucus in a position where we have consensus to move forward next week or to move forward when we get back in September. But there are meetings that are going on round the clock, and there is just another great breakthrough in terms of regional disparity and an issue that means an awful lot to about 17 states, and whether they be on the West Coast or whether they be the Midwest, people have been working tirelessly to come together because they know how important this is for the American people. Well, this is something that we can't fail.
Certainly, there's been a lot of work done. There's been a lot of work done. Pardon the interruption, Congressman. There's been a lot of work done, certainly, but there's also been a lot of criticism, even from within your own party. Congressman John Tanner of Tennessee is saying that the House leadership, Democratic leadership, and the Senate Democratic leadership needs to do more to get both houses of Congress on the same page. How do you answer that? You're part of the leadership group in the House.
It wouldn't be a democracy if there wasn't criticism. And a number of the concerns that members raise, including John Tanner, are all valid concerns. We have to come together as a caucus because I think John Tanner would be the first to agree that the most important thing is that we have health care for the American people, that you don't have to worry about a pre-existing condition, that if you have heart disease or cancer or a child that was born with autism, that they're covered, that you're not going to go bankrupt, that we put a cap on these. These are the things that are important, and not to do nothing, which those on the other side would prefer, leaves us in such a god-awful state, both economically and also morally, in terms of people. 14,000 people a day lose health insurance coverage. Health insurance coverage has become synonymous with a job. It's now under this bill will be guaranteed issue. No pre-existing conditions. This is what the American people want. Whether you have a job or you don't, whether you quit, get fired, or retire, it's portable. It goes with you. We are going to create a new and unique American system, combining our entrepreneurial strength of this great nation of ours, along with the commonweal arguments that bring us together as a nation. That's why I'm confident that this is going to pass. We'll work through the problems.
That sounds like a great, and I think a lot of people would welcome it. How do you pay for it?
Well, here's how you pay for it. You know, the president summoned everybody down to the White House, and rightfully, those very important industries stepped up to the plate. They said they could get close to $2 trillion in savings over a 10-year period. The bill that we're currently talking about costs about $100 billion a year, or $1 trillion over 10 years. What we want to do is make sure that we have a trigger. Here's what the trigger says, very simply. You said you could achieve those goals. We believe you. We're just going to hold you accountable if you can't.
All right.
And so I think in doing that, we have more than ample enough amount of savings, some which can't be scored, which becomes an issue with respect to our words. But I think by changing the language, having outside validators, insurance industry from my home state of Connecticut says, my God, you guys are talking about 15 to 20 billion in savings in health IT. We think there's 500 billion. So we're going to engage the private sector and do it with triggers so that there doesn't have to be a tax on people until we've exhausted every single attempt to make sure that we can wring out these costs and provide America with the health care it deserves.
Congressman, it'll be interesting to see whether Democrats can come together and make all of this happen. Congressman John Larson of Connecticut, a member of the Democratic leadership team. Thank you.